I'm Beth Lewis, and I'm an associate professor in the School of Kinesiology, and I do research and teach in the areas of exercise psychology, more specifically motivational interventions for physical activity, and then also how exercise affects mental health. So I always talk about, and most people have heard of obviously postpartum depression, and we know that about 10 to 15% of women who have babies then suffer from depression. And postpartum depression is defined as anywhere between right after having the baby to 6 months postpartum. Sometimes even it can happen up to a year. And what our interventions are designed to do we try to help prevent postpartum depression by motivating women to exercise. And so typically we will have, after they have their baby, they'll come in, not come in physically, but we'll talk to them on the phone, and we'll try to motivate them to exercise. And we know that people who have a history of depression prior to having their baby, they have about a 30% chance of having postpartum depression. So that's who we specifically target. So, and we know that depression, exercise is helpful for depression in general for the adults. The research has shown that it's just as effective as antidepressant medications. If you can get people to exercise, that's the problem. And so what we've done is really taken that a step further to try to have it to look specifically at postpartum depression. The title is The Efficacy of Exercise and Wellness Interventions for Preventing Postpartum Depression. So this was a large NIH-funded trial, an R01 intervention, where we in 2012, we began the study, and we recruited women who have a history of depression, and then we randomly assigned them to either have a 6-month exercise intervention where we have telephone counselors call them and motivate them to exercise. And then they're either assigned to that or a wellness condition where we talk about health and wellness issues, sleep issues, stress, those kinds of things. Or they're assigned to usual care where they get nothing. And so then after 6 months, we'll see if the women who were assigned to the exercise intervention were less likely to develop postpartum depression. And we also look at them again at 9 months as well to see if they're less likely. And then the usual care condition will get the intervention after the 9 months. And we just finished recruiting a few months ago, and so we recruited 450 participants into our study, and 41% were ethnic or racial minority individuals. So we're pretty happy, and we'll hopefully have our results soon. More globally, what we look at is how to effectively motivate your average person who doesn't do any exercise to exercise. And so I have a course that's called Motivational Interventions for Physical Activity. And this course talks about sort of the theoretical background to how to motivate someone to exercise. And then we also look at the practical application in terms of what kind of strategies you can use to increase exercise. For example, we talk a lot about helping with people to feel intrinsically motivated to exercise. So we talk to them about how they feel when they're done exercising, and hopefully that will help them motivate them to exercise more in the future. I also teach the undergraduate research methods course, which is required for all undergraduate kinesiology majors. And again, obviously I integrate my research findings and all of the research methodology into that course as well. There's been a more recent focus on prevention, so not just treating depression or health problems, but trying to prevent them. So exercise is one of the best things that a person can do in terms of prevention for medical and mental health issues. And so there's been an increase in, for example, employee health programs that people can have access to for free as part of their as part of being an employee in a large corporation. And so companies are employing health counselors to help motivate people to exercise and do other things like quit smoking. So I could see somebody who takes my course or takes related courses in this area to get sort of a health counseling type of job. I also think we have many pre-physical therapy students in our department, and I think that this area can be really helpful because if you're trying to motivate somebody to do their rehabilitation at home, oftentimes they won't adhere to that, so they can use some of the strategies that we talk about in my class to help people who are injured and need to be doing exercises at home to kind of help how they adhere to that. So more indirectly sort of related to physical therapy as well. And also just general health and wellness in corporations, through insurance companies, employer groups, and so on. I see that broadening and expanding. Well, going back a little bit to this idea of prevention, and I think that our society is so focused on treating issues, so treating your diabetes or treating depression. And instead, I think we need to focus more on prevention. And I think that this degree path sort of gives you that opportunity to focus on one of the the biggest modifiable risk factor we have, which is whether or not you exercise or not. And I think focusing on that can have a big societal impact over time. And I think there are going to be more jobs available in that area. In some of the preliminary data, we have shown some correlations between exercise and preventing postpartum depression. But one of the things I want to look at is, like, for example, does outdoor exercise versus indoor exercise matter? Does intensity matter? Are there, weight changes that have an effect? Weight changes and depression go hand in hand. So does exercising at different intensities affect weight, which then would affect depression? So sort of there's a lot of new areas that I'm interested in exploring in the future and discussing more so in class as well. They've shown that exercise increases serotonin, which is what we know happens with antidepressants as well. And so it could be that that's the mechanism. We don't know exactly what the mechanism is. It could be if you exercise with somebody else, you're getting social support as well, and so that could be the mechanism. So there's lots of things that are potentials. I haven't looked specifically at the exercise physiology piece of it.